See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist Shauna Butler.
I'm Shauna Butler, the host of See You Now, a podcast that shines a light on the nurses addressing today's most challenging healthcare problems, and never has that light been as important as it is right now. Nurses are on the front lines of the coronavirus pandemic. As the entire world learns about the coronavirus and responds to the massive disruption to our healthcare systems and teams, it has challenged nurses to rapidly rethink and redesign our existing care delivery practices and figure out ways to combat a pathogen we know very little about. Over the next few weeks, we're pausing our regular production of See You Now to bring you stories from the nurses in the midst of the coronavirus pandemic as they care for all of us. Every day, we read headlines about the risks our healthcare teams and essential services personnel confront in efforts to keep our communities safe. Behind those headlines are stories of daily experiences and individual lives. One of those stories belongs to emergency department nurse Jennifer Gil. Jennifer tested positive for COVID-19 just as she was gearing up to work in this new normal.
Our anxieties and our feelings are real. We are worried not only for ourselves, but for our family members. My name's Jennifer Gil. I am 31 years old. I'm an emergency care nurse at Thomas Jefferson University Hospital, located in Philadelphia, Pennsylvania. I am also a graduate student at the University of Pennsylvania, studying my MSN in health leadership. One of the things I found very comforting through this whole experience was actually keeping a diary of my feelings throughout the process and my symptoms. I started by saying, one of my favorite parts of the workday occurs right before it starts. My walk to the hospital. Headphones in, favorite song on repeat, and my closed sneakers against the pavement. I was scheduled to work the first shift that weekend as a frontline nurse. It was that particular shift that I was walking in and they were screening us for our temperatures. I was definitely scared, hearing everything that was going on and the possibility of contracted COVID-19. But the reality for me was that I had a duty and I was being called to that duty. So I was excited to go into work. But at that time I was flagged and I had a fever. Is this what a pandemic looks like? A busy ER, everyone on high alert, and nurses conversing on the latest news regarding COVID-19. Are we ready? Am I ready? I felt fine to work. I remember telling my charge nurse that I feel fine. I don't have a fever. I don't feel like I have a fever. I'm good to work. It was a denial that I went through and felt bad that I had to go home and not be there for my colleagues. I felt guilty. I was honestly scared. I didn't want to worry people or add any additional burden. Day 3. I woke up at midnight in a cold sweat. Chills, severe 8 out of 10 headache, severe body aches, abdominal pain. That's when the GI symptoms started to unfold. My temperature was 100.8. You're kind of left alone with your thoughts. And that's when you start to get all the fears and anxieties. Thank God I'm not staying with my family. At least they're safe. What's going to happen to me? I'm young. I'm healthy. When will I be able to see my family again? My heart sank. Maybe don't think about that right now, Jen. Stay calm. Take a deep breath. You're going to be fine. But what if I'm not? I wish now that I felt comfortable to even talk to my family members about how I was feeling, because I carried a lot of that stress and then ultimately led to just one night of me crying it out. But I think it's helpful to share, and I think it's helpful to lean on each other. We need to think about how that plays a role in our healing process. Day 7, my energy levels lowered again. My temperature was 99.1. I tried to concentrate on schoolwork, but couldn't. Mild headaches started again. I now had sinus congestion and a frequent strong cough, making it difficult to breathe. I was emotionally and physically drained. My anxiety levels were high. I can't do this again. Why is this happening? Why am I getting worse? Am I going to die? A lot of the conversations are, what are your symptoms? And what are you going through? Because people are curious and people want to know that. And it's important to talk about. But no one is really asking, how are you coping with this? How do you feel emotionally? No one really asked me that. Day 10. I can breathe. Finally. My temperature is 98.2. Congestion is slowly parting. I have a very mild cough, but my energy levels are rising. Concentration is a challenge, but that's okay. I should rest. Phew, this is over. I'm going to be okay. I think in terms of lessons learned from my experience personally, going through COVID-19 and going through all the development of the symptoms and getting better and realizing what I needed at the time, I think that we need to shift our conversations to be not only in addressing the pandemic, but also in bringing awareness of what people are going through. It's quite difficult in terms of social isolation. You know, the hugs and the reassurance and the touch and being with your most loved ones, that support is not there. And so we need to think of how can we support people, the public, support people who are in the front lines, support the people who are home. How can we have those conversations and shift it in a positive way? I think if there's one lasting thing that I would want to share with others is it's okay to be scared and it's okay to be vulnerable. We just have to talk about it and support each other.
What are we bringing home from our hospital shifts at this time? Hopefully not the virus, but definitely heightened emotions, fatigue, fear, a replay of events, the volume of sounds, last and lasting images, lingering words, and tales that affect our family's emotions. There are so many stories, so many lives, collectively shown as lines and curves on charts that don't reveal the names, the fears, the faces. These mind-boggling numbers and data points each have a soul. It's increasingly hitting me that the isolation, the distancing, and the physical barriers are the hardest things about this pandemic, that they amplify our fear and strip us of our greatest tools for comfort and reassurance: touch, physical presence, ritual, certainty, closure. As Winston Churchill once said, courage is what it takes to stand up and speak. Courage is also what it takes to sit down and listen. While managing other people's grief, pay attention to how you're feeling. Don't ignore this. This is real. We're here, and we see you. For See You Now, I'm Shauna Butler. Thanks for listening, and thanks for speaking.
Johnson & Johnson and the American Nurses Foundation are excited to launch the Coronavirus Response Fund for Nurses. Go to the American Nurses Foundation website to learn more, share, or donate. And thanks.